Module 10, Sleep and Rest. Let's first talk about the difference between sleep and rest. So sleep is a cyclically occurring state of decreased motor activity and perception. So our body functions slow, our metabolism falls, and the body conserves energy. So sleep is characterized by an altered consciousness. While we are sleeping, we're unaware of the environment around us, and our brain will respond selectively to external stimuli. For example, while you're sleeping, you may not hear all the sounds going on around you. However, you will wake up to your alarm clock. So that is one example of how we're always on alert, yet our brain will choose to kind of set some of that stimulus aside. Rest, on the other hand, is without sleep. Okay, so you're not sleeping. Instead, the body's at rest. The body is disturbed by all of that exterior stimuli. Okay, that's the major difference. So this can be mild to no activity. It really depends on the person, on what they feel their rest is. Some people can listen to really loud music, sit on a couch, and they are resting. Some people need it absolutely quiet, laying down in a bed in the dark, and that is their rest. So all rest leads to feeling refreshed. However, sleep restores the body, so rest alone can't do this. So we need both sleep and rest. Next, we'll talk about the benefits of sleep. So there has been a lot of research on sleep, and there are still a lot of things that we don't completely understand or know exactly how they work, but we do know that sleep is good. So sleep increases mental performance, it helps improve learning and adaptation. It also helps the storage of long-term memory. So think about that. If you're not getting good sleep before an exam, then you're not going to retain any of that information anyways. So it is in your best interest to get a good night's sleep. So other benefits of sleep, restores energy. We kind of reboot overnight. Sleep also appears to reduce stress and anxiety. So it improves our ability to cope and concentrate on all the things that we do every day. So more sleep also reduces the body's sensitivity to pain. So sleep is good. Sleep also strengthens our immune system. So it also works the opposite. If you don't have enough sleep, if you are deprived of sleep, then your immune system will actually become weaker. So illness and injury actually increase the need of sleep, and at the same time, it makes the patient or the person makes it more difficult to sleep, because when you're sick, you don't feel good, you could have pain, maybe you're not able to breathe properly, or maybe you have a wound and you can't position yourself properly, so that will wake you up. But your body actually needs more sleep than it normally would in order to recover and heal. A few terms to know here would be circadian rhythm. So these are biorhythms or biological clocks that are controlled within our body and synchronized with certain environmental factors like light, darkness, even gravity affects our biorhythm. And our biorhythm influences many of our physical and mental functions. So for example, if you have a patient or you works night shift, working at night is not a normal circadian rhythm because we as humans are usually awake during the day. So that would take a bit for your body to kind of switch that circadian rhythm before you can function optimally. Next is our reticular activating system, or RAS system. So this involves our brain and neurotransmitters, and these help us to promote feelings of sleepiness and awakeness. Then we have our stages of sleep. We have non-REM and REM. So REM is rapid eye movement. Now we're not going to go into too much depth about the stages of sleep, so I'm just going to tell you what you need to know. Okay, so the two main categories, non-REM and REM. So in the non-REM stage of sleep, the non-rapid eye movement, this is when our physiological functions in our body begin to slow. Cortisol is at its lowest during this phase, and our body relaxes, our body temperature lowers, our heart rate slows, our respirations decrease, and our blood pressure also decreases. And it is thought that during this phase, it is important for memory consolidation, where information that we've gathered or skills move into long-term memory. Then we have our REM sleep cycle, which is rapid eye movement. So this is when the brain becomes highly active And if you were looking at brain waves, it would actually resemble somebody who is fully awake. So patients will experience that rapid eye movement while their eyes are closed. You can watch this. You've probably seen this before. There's also more spontaneous awakenings during this stage than any other stage, and you usually will dream during this stage. And REM sleep is essential for mental and emotional restoration. Okay, so I'll say that again. REM sleep is essential for mental and emotional restoration. So if you don't have REM sleep, like if you keep waking up, you don't get to go through that cycle, then that's going to start to impair your memory and also learning. So sleep is very, very important. And then throughout our sleep, say we're sleeping for 8 hours, we will cycle back and forth through the non-REM cycle and the REM sleep cycle. Moving on to factors that affect sleep. There are many, many factors that affect the way a person sleeps. So here we're just going to go through a few. So we have age. So sleep patterns are affected by age. So for example, newborns and young children will experience prolonged REM sleep periods. An older adult will go into REM quicker and then also stay in a long time in this phase. So developmental stage also plays a role in your sleep cycle. Lifestyle factors. So let's see, physical activity. If you're very active during the day, then at nighttime you'll be more likely to fall asleep easier and for longer. Food and alcohol. So there are some foods that we suggest you take before you go to sleep and some foods that you should avoid. So for example, some foods like milk, cheese, and certain animal products help to induce sleep by converting their essential amino acids into serotonin. So that would be a good thing. Foods like heavy carbohydrates or foods that are high in saturated fat are things that we should not eat right before bedtime because that may interfere with sleep. Alcohol. Although you would think when you drink alcohol, it kind of makes you very relaxed, it's a depressant, it would help you go to sleep. However, we would always suggest no alcohol before bedtime because alcohol disrupts that REM cycle and it can actually cause spontaneous awakenings. In addition, alcohol can cause vivid dreams and nocturia. So because alcohol is a diuretic, it can make the patient get up frequently to void or to use the restroom. Then we have medications. So medications can be prescribed or they are available over the counter. These are sedatives, tranquilizers, opioids, hypnotics, amphetamines, antidepressants. All of these can affect sleep. So the patient may take these for sleeping, or these medications could have a side effect of sleep. So we want to make sure the patient has been educated on the side effects if they're not taking it for sleep. And then we have sleep habits. So sometimes we don't have very good sleep habits. You know, we go to sleep at 2 in the morning and then we wake up at 10, or maybe you have to work, so you go to sleep at 1 in the morning and you wake up at 5. So all of these things can affect your sleep. Then we have illness. So when you're sick, your body actually needs more sleep and more rest. And as you know, if you are sick and if you're in the hospital, it can be difficult for patients to get a good night's sleep. So we need to keep that in mind, and we're going to talk about that later. Environmental factors. So we have to be comfortable when we sleep, whether we're at home or in the hospital, and temperature, humidity, noise, light, odors, and the comfort of the bed that we're sleeping in also plays a role. So think about it. If you're a patient, you're in the hospital, you've been there for a week, it's really warm, it's always noisy at night, there's unfamiliar sounds and odors, and your bed is very uncomfortable. You're probably not going to get a very good night's sleep, but you're going to see how important it is to promote sleep in our patients because it really facilitates them healing. Okay, moving on. We're going to briefly go over some common sleep disorders. So we have insomnia. We've all heard what that word means, and we think about it as not being able to sleep, right? But really the definition of insomnia would be when at least 3 nights per week, okay, so you can't sleep for at least 3 nights per week and it's present for 3 months or longer. So that means 3 nights a week you cannot sleep, and this has been going on for 3 months or longer. That means that you can be diagnosed with insomnia. Then we have circadian disorders. This is where, again, your sleep-wake cycle is kind of, it doesn't match. So the example I gave earlier was working night shift. You're up at night and you sleep during the day, or jet lag. So say you're traveling across time zones and it's supposed to be nighttime where you are, but the sun is out because it's daytime. Or rotating shifts. So maybe you work night shift a couple days and then you work day shift, and then it kind of flops back and forth. So all of these things can put a strain on your sleep-wake cycle, and it can cause some side effects. Restless leg syndrome. So this is when the patient is sleeping and the leg literally becomes restless. It's involuntary, uncontrollable, and it wakes the person up at night. This does run in families, and it is most common in older adults, and it can sometimes be associated with low levels of iron and use of some antidepressant medications. So some things you can do to help alleviate this would be to have the patient stretch their muscles in their legs before going to sleep, or they can also massage their legs a little bit. So that can help with a better night's sleep if the patient has restless leg syndrome. Then next is hypersomnia. Hypersomnia is excessive daytime sleepiness where you doze off, you nap, or you fall asleep at times and in situations where you should be awake and alert. So say you're at work, you're in a big meeting at a table, and you're falling asleep. So sleep disorders that typically cause hypersomnia are obstructive sleep apnea and narcolepsy. So just because you doze off once during a meeting, does that mean you have hyperinsomnia? This is excessive, okay? Excessive, it happens a lot. So hypersomnia also may be related to other disorders of the central nervous system, so like the brain or other organs like kidney, liver, or other metabolic disorders. It can also be a sign of depression. So if a patient presents to the doctor's office and they're describing these type of characteristics of hyperinsomnia, then that's definitely something you should investigate further. Then we have sleep apnea. So sleep apnea is periodic breathing cessation for at least 10 seconds during sleep. So patient is sleeping and then they stop breathing. So this also usually has a characteristic of snoring, and they're not getting a lot of sleep because they keep waking up, they're gasping for air. So they're very irritable the next day. Their sleep partner may complain of loud snoring, or the sleep partner may actually witness these apneic episodes. When the patient has this apnea, they have a lack of oxygen to their whole body essentially, but their heart is very, very affected by sleep apnea. So these patients can have really severe cardiovascular conditions as a result. So that's something that should be reported and treated. Then we have narcolepsy. This is a chronic disorder where the brain's ineffectiveness in regulating sleep-wake cycles normally. So this is when there's something wrong with the brain and you're going to sleep. It's uncontrollable episodes of sleep during the day. It's all of a sudden. Okay, so that is that. Next are parasomnias. So parasomnias are disorders that mimic activities or behaviors of an awake person. So you're sleeping, yet you're experiencing sleepwalking or talking. Bruxism, which is when you grind your teeth and you can hear it grinding. Night terrors, where you're suddenly woken up from sleep and you're hallucinating, you have really, really strong emotions, but you don't really remember what happened. Enuresis, that's bedwetting after an age where you don't wet the bed anymore. So these are parasomnias, and what you want to remember with this one is safety. So if a patient is prone to sleepwalking, then we want to make sure that they are safe. So there's nothing they can fall over, fall into, trip over, maybe a night light. Okay, so fall precautions for patients who have any type of parasomnia where they're getting out of bed and moving around. So our assessment for sleep, we want to ask the patient what their normal sleep patterns are, what their sleep rituals are, like their bedtime routine. sleeping environment, where do you sleep? Are they homeless? Do they have their own room? Do they share a room? Do they sleep on a couch? Sleep aids, what do they do to help them sleep? Are they taking prescription medication, over the counter, some type of herbal supplement? Do they drink warm milk before they go to sleep? Stuff like that. And then any sleep changes or problems. So if there's been a change in their sleep when before they were sleeping just fine, maybe there's something else. Maybe they're having anxiety about something, an event in life. Maybe they are experiencing some depression or something like that. So all of those things will prompt us to ask more questions. So some nursing diagnoses for this: readiness for enhanced sleep, insomnia, sleep deprivation, disturbed sleep pattern. So let's talk about sleep deprivation a little bit. So I'm sure we've all experienced some degree of sleep deprivation where we haven't got enough sleep and we are fatigued. This is talking about when you haven't slept for a while. So it's not just one night you didn't get a good night's sleep, but this is kind of ongoing. So when you haven't slept, you can experience lapses in attention and memory. You can have poor concentration, irritability, diminished reaction time, impaired judgment and decision making, altered communication. You'll make more errors. You can even experience delusions, paranoia, and other psychotic behavior if you've had very, very severe sleep deprivation or if it's been prolonged. And when you don't sleep well, when you've had this prolonged sleep deprivation, it also starts to diminish your immune system. So sleep is very important. The next one, disturbed sleep pattern. This is when the patient's normal routine has been interrupted. So this would be used like if a patient was admitted to the hospital and had to stay for, at least a day or two, couple days, their usual routine has been interrupted. Promoting sleep, very, very important because we're going to have patients in all different types of settings, and we also need to educate our patients when they go home. So you as the nurse in the hospital, we want to cluster and schedule our nursing care to avoid interrupting sleep. So if a patient has a breathing treatment with a respiratory therapist and you have medications, then we want to schedule them all together. And then maybe the CNA wants to come in and do something. So maybe you can communicate and all come in at 9:30 so everything can be done and then the patient can be left alone for a couple of hours. We want to create a comfortable, restful environment that is partly with the patient's preference in mind. So if they like the lights to be off, we want to turn down the lights. If they want the door closed, maybe it's very noisy, maybe they're close to the nurse's station, then we want to try to accommodate as much of that as possible. Now, of course, sometimes we cannot. Sometimes we can't close the door. Maybe we need to peek our head in to look at the monitor. Maybe they're a fall risk, so we can't really keep them as secluded as they would like, but we try to compromise and do as much as we can. We want to promote comfort and relaxation. So that goes with the temperature of the room, the bedding, making sure everything is clean and dry, and they have enough blankets or pillows, anything to make them comfortable. Comfort also includes pain. So we want to make sure the patient doesn't have any pain, and if they need medication, then we should get that for them. If they have sleep medication, we also want to prepare that on time for them because there's a cutoff for pain for sleep medication. So this will vary slightly by facility, but most hospitals won't give you a sleeping pill after 2 a.m. I've seen 3 a.m. At one facility, but most of them were 2 a.m. So if we already know the patient might have a hard time sleeping, we want to anticipate that and get them those medications they need. If you have a patient who has a condition that is interrupting sleep, like maybe they have a respiratory infection and they're coughing a lot, sneezing a lot, or they're congested, then we want to see if there's any medication we can give them, to relieve some of those symptoms overnight. And if they don't have that, then we want to advocate for them and call the provider to get an order. Support bedtime rituals and routines. So everyone has a routine when you go to sleep. It might be to watch TV for 10 minutes before you fall asleep, or drink that warm cup of milk, or maybe it's oral care, wash their face, put on lotion, all of those things. If we're able to support that, then we would like to do that for them. However, we don't want to encourage patients to be on their cell phones or to be doing things that are very stimulating, because that will have the opposite effect. Continuing on with promoting sleep, nursing interventions, maintain safety of the patient. So at night, it's dark, and if the patient's in the hospital in an unfamiliar environment, we want to make sure the patient is safe. And then you combine that with possible medications that the patient is on that can make them very sleepy, drowsy, sedated. Then we want an extra layer of precaution. So definitely implement fall precautions, and that includes a bed in lowest position, call light within reach, bed breaks on, maybe a dim light, and even use of a bed alarm would be appropriate. We want to offer foods that promote sleep, not foods that are going to help the patient sleep, but then they're going to wake up right away. So warm glass of milk is a good idea. A big heavy meal full of carbohydrates is not a good idea. Patients should not drink alcohol before bedtime, and they should stay away from stimulants like caffeine and nicotine. So no smoking and no drinking caffeinated coffee before bedtime. Sleep hygiene. So that is kind of an umbrella term. It's all of the things that we should do before bedtime. So the patient should do oral care, brush their teeth, wash their face, use the bathroom, change into sleeping attire, pajamas. Now, these things we have to kind of tweak a little for the hospital setting, but this is something that we would educate our patient with when they go home. So there should be a nighttime routine or ritual. And this should include things like using the bedroom only for sleep and not watching TV while you're lying in bed. This can confuse the brain. So your brain thinks like this is just a lounge time. It's not going to get ready for sleep. Versus if you go to your bedroom, turn off the lights, no TV on, no cell phone, and you close your eyes and go to sleep, you're more likely to fall asleep quicker and sleep longer. You want to encourage the patient to find things that help to calm them before bedtime, like maybe reading a book, or using guided imagery where they close their eyes and think of a place that's very calming and relaxing. Like, I'm at the beach, I can hear the waves, I smell the salt in the air. Those kind of things can help kind of relax you before bedtime. What they should not do is depend on sleeping medication. So if a patient is complaining of issues with sleeping, the first response should not be, let's give you some sleep medication. We want to try all the non-pharmacological things that we can do before medication is even suggested. And exercise and physical activity before sleep. So exercise is a good thing. It helps to raise the body temperature, and it kind of tires us out, and it provides oxygen that our body needs, and it helps to relax you and you sleep better. So walking or exercise early in the evening, at least 1 hour before bedtime, is ideal. We don't want to do strenuous activity right before bedtime. And overall, we want to educate our patients on how important it is to get good rest and a good night's sleep. And just remember that REM sleep, that second stage in our sleep cycle, is essential for mental and emotional restoration. And when we go sleep deprived for prolonged periods of time, we will become very fatigued, and we'll have, remember, all of that irritability, lapses in judgment and memory, poor concentration, restlessness, delusions, all kinds of things can happen. And in addition, it can also make us sick. So it can cause cardiovascular issues, it can cause heart disease, it can cause weight gain, and it can cause changes to our immunity, so patients can get sicker easier. A good night's rest, good sleep can help with anxiety. It can improve our ability to cope and concentrate on our activities of daily living. So we want to make sure patients get good rest, whether they're at home or in the hospital. And the last thing I want to mention is that sleep is subjective. So when you ask a patient, say you are in the hospital and your patient slept the whole night, 8 hours during your shift. In the morning, when you're giving a report to the next nurse, you're not going to say the patient got great sleep last night, they feel well rested. Not unless the patient told you that, because just because you sleep for 8 hours and your eyes are closed, it doesn't mean that it's good quality sleep. So we always want to ask our patient, how did you sleep? Do you feel well rested? Do you feel you slept well? And it's kind of like asking about pain. So whatever they say, that's what it is. If they say, I was tossing and turning last night, I didn't get good sleep, even if you saw them asleep every time you went in the room, it doesn't matter. It's based on their subjective account of how they feel. Okay, and that wraps up this module.